Hi everyone, and welcome to TS Fibro. Today's video is on pregnancy and fibromyalgia. If you haven't subscribed to YouTube yet, go up to on the right hand side of your page and it'll say sign in. Just hit that and create a YouTube channel. You don't have to do anything with the channel. It just gives you an opportunity to subscribe to other YouTube channels that you like and get notifications of videos they put up. If you want to make a channel, you can, but you don't have to. Then if you just hit the subscribe button and hit the notification bell on the bottom of my page, or well, you'll see it. It's in red. It says subscribe. Just hit that and then hit the notification bell and it will give you a notification of whenever I put up new videos. And if you like the video, thumbs up. Simple as that. Okay, let's get started. If you have been diagnosed with fibromyalgia, you're already used to the challenges the condition comes with, including pain and fatigue. For some women, these challenges can be even more difficult during pregnancy, but the good news is that your baby won't be affected at all by the condition. Here's what you need to know to manage your symptoms and enjoy a happy, healthy pregnancy. Some recent studies and plenty of anecdotal evidence have suggested that pregnancy can be extra tough on women with fibromyalgia. This could be because the added physical and emotional stress of having a baby can cause symptoms to flare up or become exacerbated. Or if your practitioner misdiagnoses fibromyalgia symptoms as simply a normal part of pregnancy, you may not receive the treatment you need to feel better. That's why it's so important to learn everything you can about both fibromyalgia and pregnancy so you can make sure you get the care you need. Some pregnant women with fibromyalgia feel more tired than usual, especially in the first trimester when exhaustion hits all moms-to-be. They may also experience more headaches and pains, and in more parts of the body compared to an expectant mom without fibromyalgia, especially during the third trimester. That said, some lucky women actually feel better during pregnancy. You can definitely hope for that. Ask your doctor about the best ways to minimize your symptoms. He or she may suggest trying to reduce the amount of stress in your life as much as possible, eating a well-balanced diet, taking warm baths but not hot, exercising moderately but never overdoing it, and doing safe stretches and conditioning exercises like yoga, water exercises, and so on. That may have helped you before your pregnancy. If you suffer from overwhelming fatigue, aches, or faintness, make sure you rest and take breaks multiple times a day, or however many times your doctor recommends. Seek support from family members and friends, and don't be afraid to ask for help. For example, a home-cooked meal, a ride to doctor's appointments, or words of encouragement if you need it. Medications during your pregnancy. Because the symptoms of fibromyalgia are often treated with antidepressants and pain suppressants, you'll need to make sure your doctor and prenatal practitioner are in contact with each other and only keep you on medications that are safe for use during your pregnancy. It's also recommended you discontinue any naturopathic treatments due to the lack of solid information on their effects on an unborn child. Non-medical treatments like massage, exercise, yoga, acupuncture, and meditation are safe as long as your practitioner gives you the green light. If you haven't been using these remedies before pregnancy, now might be the perfect time to try them out. Postnatal care for women with fibromyalgia. Pain, fatigue, mood swings, and other difficult symptoms are part of the postpartum period for many women. But for those with fibromyalgia, the weeks and months after birth can be even more challenging. Try to line up some help for after you give birth to assist with the baby or your household tasks like errands, cooking, cleaning. You'll be glad you did. Pregnancy isn't easy no matter what. and it can be even more challenging for moms to be with fibromyalgia. But being aware of your condition and knowing how to manage your symptoms actually gives you a head start that many women don't have. And besides, that cuddly reward, that beautiful baby you're working so hard for, can make all the challenges more than worthwhile. Here are 10 questions asked about fibromyalgia. Number 1, what is fibromyalgia? Fibromyalgia is a multi-system disease. Because of this, there are several reasons to be concerned about its effect on pregnancy. Fibromyalgia involves the nervous system and muscles, the immune system, a number of different hormones, automatic nerve control of the skin, heart, blood vessels, gastrointestinal tract, and bladder. Symptoms such as persistent, widespread pain and severe fatigue that usually lasts years, if not indefinitely, characterize this disease. Fibromyalgia is the disease of a million myths. Because of all the misunderstandings, half-truths, and untruths that exist about it, one of these myths is that it is strictly a middle-aged and older women's disease. However, children and men get it too, and more than half of the women with fibromyalgia are under age 40, still in their reproductive years. Number 2, how does pregnancy affect fibromyalgia symptoms? Not every pregnant woman's experience with fibromyalgia will be the same. However, all women typically experience an increase in pain, especially over the last few months of pregnancy. This is when even healthy women tend to experience discomfort. At this point in a pregnancy, the woman is gaining weight rapidly, the baby's growth is accelerating, there is an increased pressure on the lower back, which is often a problematic area for people with fibromyalgia. On the other hand, chemicals like relaxant are released in the body during pregnancy, among other things, that help to relax muscles. This may have some beneficial effects. However, overall, the average woman with fibromyalgia will notice a significant increase in her pain. This is especially true over the last few months, and particularly in the low back and hip areas. Number 3, how does fibromyalgia affect pregnancy? First, you have to understand how fibromyalgia affects the likelihood of pregnancy. Though there has been little research in this area, there's no evidence that fibromyalgia negatively affects how fertile a woman is. However, many women and men with fibromyalgia experience discomfort during sexual activities. This may cause them to engage in sexual activities less frequently. Once a woman becomes pregnant, fibromyalgia can affect the pregnancy itself. For example, one study observed 112 pregnant women with fibromyalgia in Israel. Results found that these women were more likely to have smaller babies, recurrent miscarriages, roughly 10% of women, abnormal blood sugar, and excessive amniotic fluid. However, they were also less likely to have babies who were born prematurely, and they weren't more likely to require a C-section or any special procedure. Number 4, are fibromyalgia medications dangerous for pregnancies? Very few medications are approved for use during pregnancy, regardless of the condition they're being used to treat. Some drugs are purposely not tested in pregnant women. As such, there is little research about their effects on pregnancy. The traditional wisdom that most doctors follow is to discontinue as many medications as possible while a patient is pregnant. This certainly is true for fibromyalgia. Does this mean that a woman must stop all her fibromyalgia medications? Not necessarily. What it does mean is that she must discuss with her doctor the various benefits and risks of either stopping or continuing each medication she's taking. Always consult your doctor about the medications you are taking. Number 5, what is the best way to treat fibromyalgia while pregnant? Fortunately, medications are not the only treatment proven effective for fibromyalgia. Stretching, meditation, yoga, and deep heat ointments may help. Massage also may be helpful as long as it's not too aggressive. Find a massage therapist that specializes in pregnancies. Pull therapy may be particularly soothing, especially for those with back pain and in the late stages of pregnancy. Exercise is important as well, but it must be tailored to your individual ability and endurance. Being in a pool during exercise may help. Rest is crucial. Even healthy pregnant women often find the need to sit or lie down to relieve pressure on their back and legs. Try to schedule a 20 to 30 minute breaks throughout the day. If you're still working and you can't take leave from your job earlier than you expected to, try to get your boss to let you rest as much as possible during a few minutes during the day. Number 6, does fibromyalgia have any effects on delivery? You may expect women with fibromyalgia to have more pain during labor and delivery than women without the condition. However, no evidence suggests a significant difference. This makes sense given that spinal blocks can now be administered to effectively relieve pain over the last few crucial hours of labor. As mentioned earlier, fibromyalgia does not appear to result in premature deliveries or more C-sections. This indicates that women with fibromyalgia ultimately tolerate labor as well as other women. Number 7, what happens after the baby is born? It's widely believed that a woman's fibromyalgia will continue to be worse for a period of time after giving birth. Fibromyalgia sufferers typically have very disruptive sleep, and research has shown that the worse they sleep, the more pain they have, especially in the morning. It's no coincidence that the mother's fibromyalgia generally doesn't start returning to baseline until after the baby starts sleeping better. It's also crucial that a mother's mood is followed closely, since postpartum depression can be missed or misinterpreted as fibromyalgia. Number 8, what is important to consider when planning a pregnancy? Once you've decided that pregnancy is something that both you and your partner want, make sure that you have the proper support in place. It's crucial to have a doctor who listens, a therapist to turn to, a supportive partner, help from friends and family members, and access to a pool. Some of this support may come from your local fibromyalgia support groups, where you may find women who have already gone through pregnancy. Breastfeeding is ideal for the child, but you may choose to bottle feed if you have to go back on medication to manage your fibromyalgia. That's something to talk to with your doctor and your partner and make that decision together. Number 10, does fibromyalgia affect postnatal mother's health and postnatal care? There is no evidence to suggest that going through a pregnancy will make your fibromyalgia worse beyond the first 6 months or so after delivery. By then, you should have been able to resume any medications that have been controlling your symptoms. However, you will continue to require the support of your partner and family and friends, just as all mothers do. Make sure you consult your doctor if you're breastfeeding, before going back on any medications. Number 9, what are the types of headaches during pregnancy? You have tension headaches. Many women experience tension headaches throughout their pregnancy, but it can be especially dreadful during the first trimester, according to the Utah Department of Health. Tension headaches resemble a squeezing pain or a steady, dull ache on both sides of the head or back of the neck. These types of headaches are usually caused by a lack of sleep, depression, and/or caffeine withdrawal. Rising hormone levels may also trigger tension headaches in some women. There's also migraine headaches. Many women experience migraine headaches during pregnancy. Approximately 15% of migraine sufferers get their first migraine during pregnancy, according to the website Baby Center. While the exact cause of migraines is unknown, it is believed that increased blood flow in the brain contributes to the onset and progression of these headaches. Migraines usually appear during the first trimester, but they can also occur later in pregnancy. These types of headaches can cause moderate to severe throbbing pain, typically on one side of the head. They can last up to 72 hours and tend to be triggered by physical activity. Migraine headaches may consist of nausea, vomiting, and/or sensitivity to light and noise, according to the Utah Department of Health. They usually occur less frequently after the first trimester, but some women report that their migraine headaches worsen or stay the same while they are pregnant. Preeclampsia headaches. A persistent severe headache during the second or third trimester of pregnancy may be a warning sign of preeclampsia. Preeclampsia, a rare condition, affects approximately 5 to 10% of pregnancies, according to the Utah Department of Health. Preeclampsia headaches are characterized by high blood pressure and excessive protein in the women's urine. These headaches consist of a persistent, dull, or throbbing pain that does not go away. The March of Dimes states that the preeclampsia headaches are usually accompanied by blurred vision, floating spots, sudden weight gain, under right abdomen pain, and/or swelling in the hand or face. Well, that's pregnancy and fibromyalgia. I hope you got some questions that you had maybe answered. If not, leave me the question in the comments below, and I will get to it just as soon as I can. Thank you all for coming. Don't forget to subscribe, hit the notification bell so you'll be notified of videos, and hit that thumbs up. Thank you, everyone. I pray for a cure, and I pray you have a pain-free day. God bless.